Hey, it's Roberto Mickey again, and we've got a great video today in our series of hand questions for medical students, residents, and fellows studying for the boards or in-training exams. In a patient who is unable to flex the interphalangeal joint of the thumb after a distal radius fracture, what is the most likely treatment option that led to this complication? A. External fixation. B. Closed reduction and long arm casting. C. Closed reduction and short arm casting. D. Open reduction internal fixation with volar plating. Or E. Percutaneous pinning. Here's a chance to pause the video if you want to think about it and answer the question yourself. The patient presents with the inability to flex the interphalangeal joint of the thumb, which means that the flexor pollicis longus tendon is most likely ruptured. The most common scenario for rupture of this tendon is an open reduction internal fixation with volar plating. The mechanism of injury is suspected to be mechanical abrasion with the volar plate, especially if it is placed beyond the watershed line of the volar distal radius. So this is a sawbone model of the distal radius, and you can see that we've marked the watershed line with the blue dots. And that watershed line goes from the radial aspect of the wrist to the ulnar aspect, and it is the most prominent ridge of bone on the volar surface of the distal radius. And you can see it here on the lateral view of that bone model, that if you were to drop a drop of water on along that line, half of it would go one way and half of it would go the other way. So this is just like on a mountain ridge or in a continent. There's a watershed line where water runs one way or runs the other way. And for example, in the Rocky Mountains, there's a watershed line where half of it goes to the Colorado River and half of it goes to the Mississippi. So why is this watershed line important? Well, in plating of the distal radius, you want the plate not to be the most prominent thing. And so if you put the plate here, then it is not the most prominent thing on the volar surface. Still, the watershed line is the most prominent. But if you put the plate a little bit more distal, like in this case, where it's right up against the watershed line, then the plate becomes the most prominent thing on the volar surface, and it is what's rubbing against the flexor tendons. Hence, you want to keep your plate more proximal to the watershed line to avoid rupturing the flexor pollicis longus tendon, which sits right in the middle of that ridge. So the answer is D, open reduction internal fixation with volar plating. Well, everyone, thank you for watching, and here are some references if you want to read a little bit more about the watershed line and flexor pollicis longus tendon ruptures after volar plating.